In this video, I'm going to walk you through a conservative treatment protocol for a complete Achilles tendon rupture. So this means you've totally torn your Achilles tendon and the option is not to go for surgery. How do you manage it then? I'll discuss week by week what the protocol is with how you set up the boot and everything, what exercises you can expect to be given, and when you could expect to start weight bearing and even return to sports. Now, if you have a partial tear of your Achilles tendon, this video is not the right one for you. The protocol is totally different for that. Have a look at the description of this video. I'll put a link to the playlist we have about partial Achilles tendon ruptures there. And also, if you're wondering what's the difference between surgical treatment and conservative treatment, which one should you go for? I've made a video where I discuss the pros and cons of each and how doctors usually decide which option is the best for you. I'll also link to that one in the description of this video. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of any type of Achilles injury, all done via video call. Have a look at the description of this video if you want a link to our website. Now, interestingly enough, so far the research hasn't really shown that there's any specific protocol for a conservative treatment plan for Achilles rupture that works better than any others. But there are some things that needs to be included that seems to lead to better results. So what are these things? The first is that you have to have your foot immobilized in either a boot or a plaster cast at maximum plantar flexion for at least 2 weeks. Now, what's plantar flexion? So if we think of the ankle, this is neutral. It's a 90-degree angle. And if you point your toes down, that's plantar flexion. It's pointing it down. If you pull it up into dorsiflexion, that's bringing it up. Now, can you see, this is the Achilles tendon. If you bring it up, you're stretching it. If you're pointing it down, you're bringing the tendon in a shortened position. So if you've torn it, you need it to be in this position for 2 weeks at least so that the ends can really come together. If you walk on it or it's put in a position like this, then the ends can't really grow together and you end up with a lengthened tendon. So that's the first element. Your foot has to be immobilized in that plantar flexed position for at least 2 weeks. The second element is starting to place weight through the injured Achilles tendon quite early, but while wearing your boot. So usually after the 2 weeks, if you've been in a plaster cast, you'll be moved into a boot and it will still maintain that heavy plantar flexion angle, but you're then allowed to start placing full weight on it. And slowly over the next few weeks, that angle will be reduced, and we'll go into detail about that in a minute, while you can still carry on putting weight through it, but always in the boot that it's protected. And what this does is the early weight bearing seems to stimulate the tendon to actually heal a bit better. Then the other thing the protocols have in common is that after about 6 to 8 weeks, depending on which protocol you look at, you can usually start moving the foot into all directions, but not into strong dorsiflexion stretches. So if I can show you, you'd be moving the foot into all directions, even a little bit up, but just to neutral, and pointing it down and moving it around there. So after about 6 to 8 weeks, you can usually start doing things like that, but not heavily up past neutral yet. But I'll go into detail about those exercises in a minute. And then the last element that they all seem to have in common is wearing a supportive trainer or shoe with a bit of a heel on it that places your foot in a little bit of plantar flexion. That just makes the transition from the boot to not having the boot on a bit easier and helps to walk a bit easier as well. I've made a video in the past about best shoes after Achilles tendon ruptures. I'll link to that one in the description of this video as well for you. Okay, so let's go through the weeks and walk through it step by step so you can see what to expect. So the first thing is, like I mentioned before, your foot has to be immobilized as soon as possible in 30-degree angle plantar flexion or maximum plantar flexion. So as far as your toes can point down and is comfortable in that position, that's the position they usually immobilize in. Now, some doctors prefer plaster cast because then you can't actually remove the boot during that period and it has to stay in that position. Others might just place your foot in a boot in that position. Now, you can use either a Vacoped boot that has a hinge in it, which is quite nifty and handy, or you can use one without a hinge where you then just place extra heel lifts in the back to place the foot in that position. And if you're using that option, it might be up to 5 centimeters you want to lift your heel to get that maximum plantar flex position. By the way, I've written all of this out in a blog post as well, which I will link to in the description here if you think, ooh, I'm struggling to keep up with this. Then with regards to walking, you're not allowed to put any weight usually during those first 2 weeks through that boot or plaster cast. It's really important to avoid placing weight through it at that point. So you'll be issued with crutches, or sometimes people get one of those scooter things that they can scoot around on. And yes, that's going to be your lot for at least 2 weeks. It's really important not to get fed up with the boot during that period and take it off. You have to wear it 24/7, even when you're sleeping, because you don't know what you're doing with your foot when you're sleeping. So for best results, it has to stay on. And like I mentioned, that's why some surgeons put you in plaster cast, that you can't actually remove it. You will find that your foot will swell during this period, especially if you're sitting at a desk with your feet down for a long period of time. So it's really good to have your leg up on something higher at any moment that you get the chance to do that. You're also at a higher risk of getting a deep vein thrombosis, so a blood clot, when your foot is in a boot. So it's important to keep an eye out if things suddenly swell a lot, or it becomes really painful when it wasn't that painful, or throbs, or anything is different from what you observed earlier. Just go speak to your doctor, because they can easily test for that, and it is something that needs to be treated quite soon if it does develop. Now, especially if you're an active person, it can be really frustrating to not do anything. So people often want to know, what exercise can I continue with? I usually try to convince people for the first 2 weeks not to do too much, and likely avoid exercise if possible, for a few reasons. One, that area really needs to settle and it needs to calm down. And you're going to be stuck in a plaster cast or a boot that you're not allowed to take off. So it's going to get really, really sweaty. However, if you feel you're going stir crazy, then exercises where you don't put weight through your legs or your feet are good options. So things we're thinking about is any core exercise on the floor, like for instance, doing sit-ups or crunches or Russian twists, or planks on your knees. So not planks supported on the feet at all, but planks where you have your knees on the floor and you're doing them like that, or push-ups in that position even. Or you could even just throughout the day sit and straighten that leg out with the weight of the boot or the cast and hold it for a few seconds to keep your quads strong. Also, you can be lying on your front and just curling your leg a few times to see if you can strengthen your hamstrings like that, because the weight of that cast will really help there. Do not go and exercise the uninjured side too hard. That poor leg is already going to work double as hard as normal. So if you're going to add exercises on top of that, you're likely going to cause yourself an overuse injury of the uninjured side. So be nice to that side. Don't go and hammer it just because you're bored with what you can do for the next 2 weeks. If you're finding this information useful, please remember to hit like and subscribe. It really helps the channel. Beginning of week 3, the time finally comes when you can start getting some movement through that foot, and you can start weight bearing on it. So if you've been in a plaster cast, that cast will usually be removed and you'll be placed on a boot. Now, if you have a Vacoped boot, which has the hinge, I'll put a link to that in the description, by the way, so that you can see what it looks like. It will be set that that hinge can't move past 20 degrees of plantar flexion. So you'll have a little bit of movement. Just to show you what 20 degrees plantar flexion means, this is neutral, so that's 0. 20 degrees is there, and 30 degrees is my max. Ooh, cramp in my calf. That's my max. So it's just a little bit off max, so it'll be in that bit that you can move. If you have a Vacoped boot, that's quite easy. They just set that hinge that it can't move that past that bit. If you have one of the rigid boots, like an air cast boot, it doesn't have a hinge, but you can just then lower the heel raises that you've got in the back of the boot. That is roughly 3 centimeters, but it really depends on your size as well. If you're a tiny person, it'll be fewer, so that you get that 20-degree angle of plantar flexion. You still have to wear the boot 24/7, so you're not allowed to take it off yet. You can't take it off when you sleep, and you still have to have it on when you bath or shower, all of that. But you will be able to take it off soon, so don't worry about that. The other exciting thing is that you're allowed to start placing your full weight usually through that leg as long as you've got the boot on. Now, don't just take my word for this. Check with your doctor that it's okay in your case, because every case can be slightly different and it may not be okay for you. But usually, beginning of week 3, you can start weight bearing through that leg as long as you've got your boot on. You will still have to use crutches because that angle makes it nearly impossible to properly walk. And something else that can be useful is to get a really thick-soled shoe, like a Hoka shoe. Now, if you don't know what a Hoka is, again, I'll put a link in the description of this video. just to bring you up a bit more. But in my experience, even the Hoka with the thick sole is often not enough to get you level. So having an extra, they call it a level up, that you can strap onto the bottom of your shoe can be really, really useful. Again, I'll put a link to that in the description of this video that you can see it there. You may also be allowed to start some gentle isometric exercises for your foot and ankle. What do I mean with isometrics? So isometrics is when you contract a muscle, but you don't actually get movement. So if we think of the foot, the pointing down action, if I do that, that's not an isometric exercise because I'm actually moving my wrist as I'm doing this. What would be an isometric exercise is if I just pushed into the bottom of the boot and I don't get any movement from my foot, but I'm contracting the muscles to do that push. So for your foot and ankle in the boot, you have to wear the boot while you're doing this. It'll be in that plantar flex position that you just gently push down, not as hard as you can. This is 50% or less effort. We just want to gently activate it. If you're going to push too hard, you're going to make things worse. So you gently push into the bottom, hold it for 10 seconds, release. And then the same thing for pulling it up. Because remember, the boot's going to stop you, that you can't actually pull it up into any position that's a problem. So you just gently push against the, what would you call it, the roof of the boot, that you contract the muscles at the front of your shin. And then the same thing for the side-to-side movement. So with the foot in that position, you'll just gently push out to the side against the boot and also into the inner part against the boot. And each of these directions you can do, start with very little, like 10 seconds into a direction, up to 3 repetitions, and see how your foot reacts. And then you can spread that throughout the day and gently, gently do that. But please, you're not going to speed up your healing by hammering it with this. You're going to make things worse if you overdo it. So there is a balance. A little bit of contraction is really good. Too much, and you're going to make things worse. So really just be gentle about this and maybe set the thing of I only do it 3 times a day so you don't overdo it. Now again, you're welcome to add in other strength exercises for the rest of the body, but we're still stuck with things you can do on the floor. So like the crunches, the side leg lifts, clams, anything where you don't actually put weight through your feet is usually okay to do. So you can even train the upper body with seated rows. I'm not going to demonstrate those exercises here because you can go on other exercise videos and find things that you don't actually put weight through your legs. Week 4 is not quite as exciting as week 3. In week 4, the only difference is that you can adjust the boot usually to be at about a 15 to 16 degree angle. So we're halfway between full plantar flexion and neutral dorsiflexion. As for the exercises, nothing changes. It's the same gentle isometrics for your foot. Do not be tempted to start pushing too hard or for too long. And it's also just exercises for the rest of the body where you don't place weight through that leg. Week 5 usually gets people excited because this is when things are really starting to feel as if it's moving in the right direction. You can usually adjust the boot that it's only a 10 degree past neutral plantar flexion angle, and that makes it a lot more comfortable usually to walk on as well. You can start taking the boot off during certain periods, but if you're standing or you're walking or moving, you have to have the boot on. You can take it off when you're sleeping or when you're having a bath, but whenever you're on your feet or there's a chance that you're going to slip or something like that, put that boot back on. For ankle exercises, you can continue doing the exercises inside the boot, so the isometrics, the gentle ones, but then you can also remove the boot and do some more active range of movement stuff as long as you don't go past neutral dorsiflexion. So no stretching into dorsiflexion yet. Let me demonstrate. The first exercise you can do is start moving the foot side to side without the boot on. Now, it's important, remember, we don't want to pull it up. So you're going to keep it slightly pointed and just go to neutral as you take it in and out. And you can use it, and you can also do the same thing for pointing down and pulling up. So we can go to neutral, but you just don't want to go past neutral to there. You just stop at neutral and bring it down. So it's very gently, just that range of motion that you do. Week 6 and 7 is a lot more exciting. Beginning of week 6, the boot is usually adjusted that it goes between neutral, so neutral position into full plantar flexion. If you have a Vakoped boot with a hinge, it means that you can start walking in a more normal way by rolling over your foot. You still have to wear the boot all the time when you're on your feet or walking around. And you could use crutches if you still need them. I find it best if you're going out on uneven ground or things like that where you may lose your balance to carry on using the crutches. Something that's important at this point is to try to mimic a normal walking action if you're in a Vacoped boot. It will be a bit difficult in a rigid boot that doesn't have that hinge. I've made a whole video about walking with crutches and getting that heel to toe action going. I'll link to that one in the description of this video as well. Something that everybody can try, regardless of the boot that you're wearing, is to check, am I putting equal weight on left versus right? Because one of the common things we see is that somebody gets used to not putting any weight through that injured side or less weight, and then it becomes really difficult when the boot is removed to get your weight equal again. So whenever you're upright and you're standing, just check, can I place equal weight on both? Am I placing equal weight on both? And correct it if you're not. And remember, if you're struggling to put equal weight because the one shoe isn't as high as the other, think of getting one of those level ups. They're really handy because you can strap them onto the bottom of any type of shoe. Link is in the description of this video. The ankle exercises and the foot exercises also gets quite a bit more exciting. But it's really important that you don't try these exercises if you've not practiced them with your physiotherapist or under supervision, because you don't want to get them wrong. You may be allowed to start with seated calf raises at this point, but I want to show you something. Can you see, if I bring my feet right under the chair, I've got quite a large dorsiflexion angle there. So what you want to do is have your feet further forwards that you don't go past neutral. So you're going to do the calf raises in this position. So we're avoiding that dorsiflexion stretch, because if you're going to do it in this position, it's going to end up stretching the tendon every time you go down. So feet slightly forwards, and that's the position. And at this point, it's all about thinking about the control of the movement and that you're doing it properly. Another one that you may be allowed to do is doing scrunches with your toes with the towel. But the same concept apply here. If you're going to have your foot there and do it in this position, can you see how I'm getting dorsiflexion? So you've got to have your foot further forwards so you don't go into dorsiflexion past neutral when you do it. So all you do is foot on a towel and you just try to pick it up. And it doesn't even matter if you can't pick it up. It's the action of trying to do it that gets it going. So that's the position. So you don't want to be there because that's going to bring it into dorsiflexion. A little bit further forwards. That's the position. You'll also likely be given TheraBand exercises. Now with these, it's important to not go past neutral again. So you hook the band around your foot, and I prefer to do it with my running shoes on because it just sticks better. I also like to have something under my calf that my heel is free to move. So this is not a stretch. You're not using it to stretch. We don't want to stretch at this point. We want to avoid that so we don't lengthen the tendon too much. You want to point it down against resistance and slowly bring it back up to neutral. Point it down to against resistance, bring it up to neutral. And like I say, do not be tempted to stretch it at this point because the tendon will feel quite stiff because we don't want it to lengthen, to heal in a lengthened position. You will add in stretches later in your rehab. So just pointing it back to neutral. Now for all of the TheraBand exercises I'm going to demonstrate, usually people work at about 10 repetitions, 3 sets. So you do 10 repetitions, you rest a minute, and you do 3 sets of that. And you start with the lightest band you can find. And only once it's really comfortable do you increase the resistance. It's not about how heavy you can go, how quickly. It's all about taking your time and getting the muscles and the control to slowly catch up. Then we can also train dorsiflexion against resistance. So pointing the toe down and then pulling up against the resistance band. Just to neutral. We're not going past it back there. You're just going to neutral. So slowly releasing it back down and pulling it back up. You have to connect it to quite a solid object to be able to do this. I find placing it through a door is best. Or in this case, I've got my poor boyfriend hanging on to it. You can also do inversion and eversion against resistance. So for inversion, we're going to pull in against resistance. Again, taking care not to pull up too much at this point. So we don't want to end there. We just want to bring it gently in, hold it, and gently back out. And use a really light resistance band to start with. And for E version, we're doing the same thing, just to the opposite side. So now you've tied the band on the opposite side, and if you've put it through a door, you can just turn your chair around and you're pulling it out. And we're taking care not to bring it up and out. We're just staying in neutral dorsiflexion. Week 8 is the week that everybody always waits for, because it's very likely that your doctor will tell you that you can remove the boot fully now at week 8. Sometimes they may ask you to actually keep wearing the boot until week 12. It just depends on your specific case. When you remove the boot, it's really best to transition into a supportive shoe, like a running shoe, that has a bit of a heel on it. So about a 10 millimeter heel to toe drop. For 2 reasons. One is it just makes that transition from being supported in a boot to having a lot less support, less aggressive. But also, your ankle and your Achilles tendon will be quite stiff when you come out of that boot. And it will make walking difficult. And you can easily irritate the tendon by just trying to go into that dorsiflexion, which it's not been doing all this time. So having a bit of a heel on means that you don't need that much dorsiflexion when you're walking. It can really make things easier. Have a look. I've made a whole video about the best type of shoes when you come out of a boot. I'll put a link to that one in the description of this video as well. You can still use a crutch if you feel you need one, especially at the beginning if your balance is a bit off. But the idea is that you should start weaning off your crutches and not need them after a couple of weeks. At this point, checking that you're distributing your weight equally when you're standing is really, really important. Because one of the best ways to get over that limp one has when you come out of the boot is to actually start explaining to the brain that, listen, this is my midpoint. Because for weeks and weeks and weeks now, it's likely thought, this is the midpoint, this is where we stand. So you need to teach it to come back to the middle. So whenever you're standing upright, tell the people around you in the house, if they see you being more on the side of your good side or your uninjured side, they need to tell you that you can correct it. Also, if you're standing and doing something, brushing your teeth or cooking, just check, what are you doing? Are you placing equal weight on both? Because you should start doing that, because it can handle it at this point, and it's important to get you walking again. What about walking? How much can you walk? Well, please don't overdo it at the beginning. That Achilles and ankle and your whole leg will just not be used to walking as much as normal. So don't go out for a walk for exercise or anything like that. First, just get comfortable in the house. Give shorter strides. If you try to stride out, it's going to be more difficult. And really focus on, check what you're doing with your uninjured leg, how you place the heel down first, roll over your foot, and try to do the same thing on the other side. So try to get it as equal as possible. And slowing the movement down is a really brilliant way to teach your brain how to do it properly. There are 3 main exercises for the ankle and Achilles specifically that gets added in at this point. And what you get given and how quickly you progress through them really depends on your specific case. So it's best to get guidance from your physiotherapist about what is best in your case. Do them with shoes on at the beginning to just give you that extra bit of support and protect the tendon a bit. But as you get better with it, you may even be able to do it without supportive shoes on. I do find with the calf raises where you go up on your toes, if you're going to do those, especially when you start adding weight and you don't have shoes on, you can easily injure the front of the foot. So I would always wear shoes for that one. At this point, you'll also be given calf raises to start with. So in standing, placing your weight through it and going up and down on your toes. Things that's important is you usually start with not full weight on that side, so only about 25%. Then we move on to 50% of your weight on that. I'll show you in a minute what I mean with that. And then before you start adding any weight to that, you have to get to 75% of your weight on your injured side. Please wear shoes while you're doing it so you've got good support and it's a bit kinder on the Achilles at the beginning. Also, it protects the front of your foot. And then finally, hold on to something solid to help you balance. This is not a balancing exercise. It is by no means that you should try going up and down on your toes without holding on. You're not going to get good strength if you try to do it that way. Also, a chair is not ideal because if you do lose your balance, it may come over with you. I only have a chair to hold on today. A kitchen counter or something solid like that is usually the better option. So for the calf raise, the movement you're going to do involves just going up on your toes and slowly back down. And I really want you to think about getting that slowed down, really, really slow down. So you know that you're controlling it and you're not just plonking down with gravity. Okay, so first of all, if we can say this is my injured leg, you want to place most of your weight on your uninjured leg. And you're just going to do the calf raise in that position to start with. And then as it gets better and stronger after a week or so, when you hit your rehab targets, you can move over to getting it even. So 50% of your weight on there. And again, your physio will give you clear targets as to how many reps you should be able to do of this on a day to be able to move on to the other version. And then finally, you'll be told to put 75% of your weight on the injured side and go up and down. How many repetitions should you do of this and how often? Well, it really depends on the person. If you're quite a fit person and you want to get back to running sports and stuff, you may be told to start with 10 repetitions 5 times a day and work up to where you can do 25 repetitions 5 times a day. If you're not a fit and active person, actually you're quite unfit, you may get a lot fewer repetitions to do in a day. And it's usually only when you hit that upper limit of whatever your physio told you to do that you can move on to the next version of this exercise. The key here is not to rush through anything. Yes, it is about nailing the movement, but it's also about the number of days or weeks you do that movement for, because tissue takes time to adapt. So just the biggest mistake I often see people do is that they get a target set for them and they want to achieve it within a couple of days. Actually, that's not great. It's better to only take small increments that you improve and build it all over time so the tissue can have time to adapt. So for these exercises, because they are low load exercises, they are done daily and often throughout the day. When you get to high load exercises where you add extra weights and things, that will usually only be a few times a week even, with good rest periods between the sets. Another exercise you'll likely be given is the seated calf raise. And with this, you've been doing them without any weights, just going up and down on your toes. And now we're going to add some weight to it. So you're going to add either weight into a backpack on your lap. If you don't have weights, you can add water bottles, you can add cans of food. Just make sure you keep track of how much weight you're adding so that you know how you're progressing over time. And it's all about, just as important about the slow up as the slow down. So you really want to control that movement coming up and going down. And if you find that your calf cramps when you go right up, just don't go that high. There's no need to go that high if it causes you cramping. You'll get into those positions later on as it all recovers. If you want sets and reps of any of these exercises, go to the blog article. Link is in the description. I've written it all out in there. Then you'll likely also be started on some balancing exercises. Now, whenever I say balancing exercises, people immediately go, ooh, standing on one leg. That's actually not a good idea if you've been in a boot for all this time, because you may really struggle to stand on one leg. It's usually better to start with easier versions, like for instance, tandem stance, where you've got one foot in front of the other and just work on that first. So let me show you. For tandem stance, I never know how to say that. You have one foot in front of the other and have a chair or something solid nearby that you can hold onto to get into the position initially. One leg is in front. It doesn't matter which one, because you will change position in a minute and get the other one to be there as well. And the other one is put so that the toes touch the heel. And then that's the position you stand in and you want to let go. And you just try to hold that for 10 seconds. If you're feeling really unstable, do this in a doorway that you can just place your hands gently on the doorway and have a finger on that. And then as you get better, you can change and stop holding on. But then you also want to repeat it the other way around, because usually the foot that's at the back is doing most of the work. So it's really important that you practice it with both of them. For balancing, I usually get my patients to start with 10 seconds at a time, do 3 repetitions on each leg. And then they move on to where they can do 30 seconds eventually. So slowly increase the time. And balance exercises can be done daily as well. Often, if you do it more often, like on a daily level rather than 3 times a week, you see better results with your balance. And only when you get to 3 times 30 seconds, I usually get them to then move on to more challenging ones, which may be standing on one leg. Now, when you're standing on one leg, it's not just about plonking up. Think about what you're doing. You want to think about where your weight is. It's equal at the moment. Shift it over. And when you stand and lift the other leg, don't just let everything drop. You want to keep this nice and level and slowly lift up and hold that position. And you don't have to lift it as high as you can. Just lifting it up a little bit can be quite good at the beginning, especially if you're feeling unsure. 3 times 10 seconds to start with, and you build up to 3 times 30. And your physio will progress your balance exercises to a level that's appropriate for whatever you want to get back to. If you're thinking, what about strengthening for the rest of the body? Well, there's usually not much restriction, except that you've got to start with stable double leg exercises first usually. So things like double leg squats, double leg deadlifts. And if you find that it's really pulling on the Achilles, do them with shoes with a bit of a heel lift in them. It will reduce the pulling there as well. You can start with leg curls in the gym, knee extensions. What else is there? Bridges. Just stay away initially from things that require you to really step and quick reactions. So lunges is not a good idea, for instance. But again, your physio will guide you on what is the best here for you. Now, you may be thinking, but where are the calf stretches or the Achilles stretches? Because my tendon feels so tight when I come out of the boot first. Well, it's best to leave strong dorsiflexion stretches until after 12 weeks. It's absolutely fine to start moving into the dorsiflexion position when you remove the boot. It will move into that as you start walking in any case. But strong stretches where you sustain the position for a long period of time is still not advised. So after 12 weeks, you can also start adding stretches finally. I do find, though, that less is often better than more. If people are too aggressive to think that, oh, I'm going to stretch this stiffness out of the tendon and everything will be better, they usually just end up irritating it. So a much better approach is little bits often. So your physio will give you a stretch that they feel is appropriate, but I find doing 10 seconds at a time, releasing it, going back into 10 seconds at a time, releasing it, and doing that often during the day usually get better results. If you try to really stretch it as hard as you can for even up to a minute, sometimes I hear people doing, it can really flare the Achilles tendon up initially and make your symptoms worse. So it's important to really ease slowly into the stretches and not rush it too much. But again, your physiotherapist will guide you on that. Now, after week 12, there is no set period of this week you do this, that week you do that. It will all depend on when you hit your rehab targets, how you can improve and progress on. Because every case has a slightly different healing speed, or every person has different exercise goals, for instance, as well. Walking is the one thing everybody has in common. And you can usually start doing walks for exercise when you can walk with pretty much a normal walking pattern with no severe limping around the house. When you do go out for walks, I would always wear supportive trainers with a little bit of a heel on them at the beginning. And do not walk fast. You're not trying to do speed walking. You're looking for time on feet and getting that Achilles tendon used to the distance again. So you start with slow walks, time yourself, choose likely a terrain that doesn't have massive hills in it because uphills will be more difficult, and just start slow. And then week by week, you just increase the time you walk for very slowly. But you don't increase the time plus the speed in the same session because both those things work the Achilles harder. So you usually want to build your slow walking endurance to about being able to do 30 minutes or more of strolling around, and then you can start playing a little bit with speed. But your physiotherapist will guide you on that. And you've got to be able to walk at a brisk pace for 30 minutes before you can consider actually being able to run. There are strength goals also that you've got to hit before you can run, but that's one of the things that's good to achieve before you transition to running. Now, your calf-specific exercises at this point will progress to become much heavier. You may stick to double leg at the beginning and add extra weight to that. You may transition to single leg exercises, add extra weight to those even. And if you want to get back to sports that involves running, changing of direction, or even just quick accelerations, you will have to likely include things like plyometric exercise where you're jumping or hopping. Every person's program has to be tailored to their specific goals. I mean, I'm not going to ask somebody who just wants to go walking to go through a whole plyometric exercise program. It's not something they will do, and something else in their body will likely get injured. And it's also not just about the Achilles. If you're going to do those types of sports, your physio have to think about all the other muscle groups and everything else you need for that and ensure that they prescribe you exercises that will help strengthening those. Then the final thing is usually that slow return to sports phase. So if you've hit your rehab targets and you've become nice and strong and you can do your plyometrics, you can walk as fast as you want, you've done other exercise, you want to get back to your sport. It's quite important that you break that down as well. And you don't just think, I'm going to go into full-on training immediately. It can take quite a few weeks to build the full endurance again, even months sometimes, depending on the case, and then get the speed and stamina going as well. But again, your physio will guide you on that and give you clear guidelines as to how you can progress and what the best way is. How long can you expect your recovery process to take? Well, it usually takes about 6 months for people to walk unrestricted and be happy with that part. And that's the point where they can start jogging. But if you want to be getting back to sports that requires forceful contractions of the Achilles tendon, that usually adds another 3 months of rehab on top. So you're looking at roughly about 9 months rehab from the moment you tear it and treatment starts. I often get emails from people saying, I've ruptured my Achilles tendon. Can you help me treat it? Now, we can, but not immediately. If you suspect that you've ruptured your Achilles tendon, and even if you think it's just a partial tear, you have to go see a doctor in person first, so they can scan that tendon for you and see the extent of the damage. And then you have to be treated by somebody in person for the first 12 weeks. It's not really possible to safely advise on these exercises and things via video call. Now, we have helped some people who's been in remote areas where they couldn't see somebody face to face, but the ideal scenario is that you see a physiotherapist face to face during those first 12 weeks. After you can take the boot off and you can start more active exercises like the calf raises, then we can usually take over your treatment and your rehab safely via video call, but not until that point. Brilliant. Hope you found that useful. If you've got any questions, just ask them in the comments. If you want more help with your Achilles injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. And remember to hit like and subscribe. It really helps our channel. Take care.